Welcome to Apollo Spectra Facebook Live session. It is an interactive session that regularly happens from Apollo Spectra Hospital, Alvapet, by our top specialists from different medical and surgical departments. We hope you tune into the session and ask a doctor for any query regarding arthritis and sports injury. We introduce our senior consultant, orthopedic surgeon, Dr. Nandakumar Natarajan, who is specialized in joint replacement and sports injury management from UK, who has a vast experience in performing more than 2000 joint replacement surgeries and more than 500 orthoscopic surgeries in his career, spanning 9 years following his specialization.
Hello, very good morning to all. Thank you for a very nice introduction. So I hope this session will be very helpful to those who have been suffering from arthritis or those who have what are all the doubts which has been arising very common in people regarding arthritis and sports injuries. So I will answer all your questions and regarding any queries or doubts and whatever the ambiguity you have present in your mind. So regarding the treatment options available, whether we have to go for very early surgical options or it can be cured by the medical option. So let talk about little background about arthritis. Arthritis is a very severe problem. It affects the joint due to destruction of the cartilage. So whatever might be any bone or any joint surface, the joint surface will be covered by a specific cartilage. It's called as hyaline cartilage. This cartilage will be filled with a fluid called the synovial fluid, which is enclosed in a closed cavity that usually we call it as a capsule. So this capsule holds the synovial fluid and it lubricates our joint. So this lubrication is a major necessary thing for any normal joint movement. So what happens when we get old or when we get injury or any trauma to our joints? What happens? These fluids, generally the synovial fluids which lubricate the joint, loses its viscosity, or there might be any cracks can happen in the articular cartilage surface. So due to this and due to the ignorance of these things, what happens means this is not been taken care at the very early stage. So these cracks can propagate into destruction of the articular cartilage surface, which later leads to arthritis. So this is not a rapid process. It takes years to develop all these kind of things. So when we get older also, the synovial fluid becomes, it loses its viscosity. So it becomes like a more thicky jelly-like substance. When this happens means there won't be any sufficient lubrication in the joint to provide the smooth movement in the articular surface. So this is called as the primary arthritis. You can ask some questions. No?
So you have told what is arthritis, doctor. So what are the types of arthritis, doctor?
So basically, there are three types of arthritis. Is there one? It is called as a primary osteoarthritis. The second one is called secondary osteoarthritis, and the third group, which is the more prevalent, we can't say it's more prevalent. So it's coming up in very younger patients. It's called as inflammatory arthritis. So all these three are different.
So what would be the risk factor for arthritis, doctor?
Okay. So in terms of arthritis, as I explained, three types. The primary osteoarthritis usually happens due to some risk factors. Those risk factors can be generally broadly classified into two types. It's called a modifiable risk factor. The other one is unmodifiable risk factors. So the modifiable risk factors is overweight, no physical activity, traumatic injury to the joint surface, obesity, then sports injury. So anything which damages in and around the joints, it's causing the risk factors, and these risk factors are modifiable. If you regularly do exercise, regular joint lubrication, regular movement to the joint, and avoiding sports injury, avoiding to the osteoporosis, which frequently leads to osteoarthritis also. So it weakens the bone as well as the muscle. So How this happens means during the osteoporosis, what happens means it weakens the generalized quality of the bone as well as the muscle, which plays a major role in movement of the joints. So when these muscles and bones are not actively involved, means it goes into stiff. Once that stiffness develops, means automatically the viscosity of the what I previously tell the synovial fluid gets thickened and the movement get restricted, which leads into arthritis. These are all the risk factors which can be modifiable. That means it can be prevented. So osteoarthritis can be prevented when we taken care some of the risk factors. The unmodified risk factor, it's not in our hands. It's like increasing age, it's not in our control. As well as the women are prone to develop that too, particularly postmenopausal women. These factors, then some congenital disorders which also plays a role in developing osteoarthritis. So these factors are modifiable risk factors. Unmodifiable, sorry. These factors are unmodifiable risk factors. So when you taken care these certain amounts of basic precautions, the major component of the osteoarthritis can be prevented. So the burden of osteoarthritis is very severe. When you know one in every three-person will be affected from arthritis when they turn up 60 years and older. So it is very prevalent and it's also a very crippling disorder which restricts the generalized mobility of the patients and also makes the patient to depend upon other persons to help to and to perform their daily day-to-day activities. So that's why the osteoarthritis has to be taken care at a very early stage.
So you have explained about modified and unmodified arthritis, doctor. So what would be the medical treatment for this?
Yeah, so generally the patients will be having one major doubt in their mind. It's any arthritis means there is no medical management is prevalent like that. So immediately the doctor will suggest for surgery. It's a myth. Generally, it's not that. Only 10 to 15% of arthritic patients might require surgery. The rest of the group of the patients can be very well managed with medical management in conjunction with the physical therapy. That is called, we call it as physiotherapy or regular exercises. So the medical management is like any injury. If you have any injury to the joint, in and around the joint, take adequate bed rest, limb elevation. So preserve your joint by adequate these measures like wax bath and physical therapy. That is the most important thing. You have to taken care that injury at a time. See, for example, if you sustain any injury, say the initial 1 week period, you have to be little careful. You should not further aggravate that injury. That is the major thing. And old age, if you are getting old, so you have to properly check your consult your doctors, either your physician doctor, or you can consult your orthopedic surgeons, whoever might be. So they will evaluate your bone density and can be osteoporosis treatment can be treated very early, like supplementation of calcium and vitamin D. These are the major medication group one group. The other thing are non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. Generally, these drugs will we will prescribe for short duration. For example, say 5 days or like that. So without consulting your doctors, you should not take these doctors because these NSAID have a tendency to injure the kidney when it has been taken for very long period. So these group of the drug. In some of the patients, it might be very severely, the pain will be very severe. Very rarely, they might be requiring the steroidal drugs. So these are all the oral steroids can be. Now there is a major thing, those patients who doesn't want to undergo any kind of treatment like medications or surgical options. The medical management now it has been very rapidly increased. So by giving a cocktail group of injections, we prepare with lignocaine or ropivacaine and mednuron, and with some the local steroid drugs. This we call it as tricot. So the combination of these drugs will be injected into the joint which has been specifically damaged, and this gives a very good tremendous relief. And it is not wrong in taking these kind of injections into the joint because there are two groups of thing. Even in western countries like UK and US also, they practice this thing and it is medically approved. Taking a joint injections like a steroidal injection, a single shot, will not have any systemic impact. The other thing is that, but it has to be done by a specialized like orthopedic surgeons under a sterile conditions, especially in OT only, operation theatre only, it has to be given. The other supplementation like visco supplementation injections are there. These are called hyaluronic acid, and these can be injected. And it, what happens, as I said, the fluid, synovial fluid, which has normally has to be there in the joint, it loses its tendency and viscosity. So we are adding up that synovial fluid viscosity will increase. So this is one group. And in the latest treatment therapy, we have a stem cell injections or platelet-rich plasma injections. These are the recent medications which has been available now for the patient. So it is very good when you come up in the early stage. So you can, the stem cells will be taken from your own blood. Either the platelet will be retracted, will be retrieved from the peripheral blood, or the potent stem cells can be retrieved from the bone marrow aspirate. This is like a daycare procedure, no need to get admit, and it can be done as a in the recovery room itself. So these retrieved blood or bone marrow aspirate will be centrifuged in a specialized apparatus is available. So from there we retrieve the potent stem cells. And these stem cells, when we inject into the joint which has been damaged by arthritis, so the defects which has been present in the cartilage will get healed by these stem cells. These stem cells will turn into chondroblast, and it will activate the cartilage formation in the defect. So I hope I have explained the medical management for arthritis in detail. This is for the primary arthritis. When we come into inflammatory arthritis, that is a major concern now. This inflammatory arthritis doesn't comes only in the old age group. It comes in very younger patient also. For example, 20 years also it comes, and as well as it comes in 80 years group also. It has a spectrum of ranges from even kids of 5 years also affect from inflammatory arthritis. So these inflammatory arthritis usually affects multiple joints. So that's why we call it as polyarthritis. And this inflammatory arthritis, now it has been recently termed, it also affects other systemic connective tissue disorders. So these disorders, there is a specialized field, subspecialization is called as rheumatologist will taken care of the other connective tissue disorders also get treatment when it is get affected. So in coming to arthritis part alone, the polyarthritis, inflammatory polyarthritis, these will have a synovial proliferation. These joints will have synovial proliferation, and the patients usually suffer from early morning stiffness, and their swollen joints will be swollen, and they affect both small joints as well as the large joints. For example, the large joints like knee joint, hip joint, wrist, ankle, shoulder, these we call it as large joints. Whereas in coming to small joints like joints of the hands and feet, multiple small joints are there. So that's the major reason they get dysfunction in their finger mobility as well as in the toes, they get it swollen. So these group of patients definitely has to be identified very early, since it is a autoimmune disorders. So it affects the cartilage at a very early age, and we have to identify these group of patients very early and initiate the treatment. So treatments like drug modifiable, that is a disease modifiable drugs are there, and other drugs like immunomodulators are there. And most commonly these group of patients will have a major benefit by steroidal drugs, because steroids plays a major role. But no need to worry, it can be better prescribed without any systemic side effects.
So, what are the surgical options available, doctor?
Okay. So as I said previously, the surgery might be required only for 10 to 15% of the patients who suffer from arthritis. So how they will land up? So initially they will have a very mild to moderate kind of arthritis. These arthritis can be, as I said, very well managed with medication as well as with physical therapy. So when you land up to severe articular cartilage damage and severe arthritis, so your knee or hip, usually these are the two major joints which gets affected by the arthritis, and these are the two major joints. Usually there is a good surgical options is available, like knee joint replacements or hip joint replacement surgery. So you no need to directly land up and jump into like you, whether you need, okay, you have done the medical management as well as physical therapy. So many patient doesn't know. So immediately the surgical option means, so just jump into the joint replacement surgery. It's not like that. There is another group of in between. You have one more option that is called the joint preservation surgeries. So these joint preservation surgeries are the new scientific tools are available now. So many patients get benefit by these joint preservation surgeries. So just fill up the defects in the cartilage with the help of keyhole surgeries wherever. When the defect is very minimal, it can be filled with osteochondral graft that we call. The cartilage will be harvested from the non-weight bearing zone of the concern on the particular joint, and it will be pasted into the defected portion. So these kind of surgeries also performing very well. And any ligament injury and any meniscal injury, whatever the thing, and even in terms of shoulder, like any labral injury. And hip joint, when you come means the chondral defect and the congruity of the hip joint has been deformed. So these patients definitely, but this will be decided only by the specialist doctor. Like as I have been specialized in sports injury and joint replacement as well as preservation surgery, I will evaluate the patient with MRI and specific X-rays and everything. So depending upon the defect and the damage to the cartilage, whether it can be preserved means definitely the joint can be preserved with the minimal surgeries. So once those patients who doesn't fall even in this group, like severe joint arthritis and severe things, they will require the joint replacement surgeries like knee joint replacements or total hip joint replacement.
So when it comes to knee joint replacement, what would be the recovery time for them, sir, for the patients?
Yeah, when you come knee joint now, the knee joint recovery surgery has been very sophisticated. The surgery has a very good successful rate of 90 to 95% success rate is there. And the selection group of the patient is more critical here. So those patients who have been severely damaged and severely crippled from the day-to-day activities, the joint movements is restricted very much, and the deformity. So these group of patients will benefit a lot. And now the surgery has become very minimally invasive surgery. For example, say 7 to 8 centimeter incision only. And specifically in come to, first I will let explain about the knee joint replacement. So so it is a very minimally invasive surgery, and with the advance of scientific recent advance like robotics and navigation, we perform with the very precision. So priorly the patient will be have CT, and these CT images will be uploaded into the computer, and through that the navigation or robotic techniques is available now. So very early recovery, very minimal muscle cut, very less blood loss, and without any pain. So pain will be very drastically reduced. No vigorous physiotherapy is involved in these things. And the implants, now the recently implants innovation also makes a role. So the patient can mobilize the knee joint from the immediately after the surgery on the same day or on the first post-operative day. Recovery usually anything, if you see any patients who undergo joint replacement, we will be able to make the patient to walk from the next day, but generally it will take some 2 to 4 weeks time for them to recover completely, to retain the muscle and the strength of the joint. So the initial 4 weeks will be definitely under the supervision. So no need to stay in the hospital, just it's now it become like a daycare surgery. Just 1 or 2 days is sufficient. So without any comorbid or anything, we just operate on the day, keep him for the one day, and the next day we just discharge them. So home physios will be made. Not a vigorous thing. Just initially for the first 2 weeks will be gentle knee bending and full weight bearing walking with the support of the walker. We encourage the patients to do. Once the patient gradually regain the confidence, okay, we can able to walk and everything, then the generally the motivation from the patients and the attenders only required, the relatives who motivate them to walk. Initially within 2 weeks they will be walking without any walker support or without any knee brace. Then the other 2 weeks will be like gradually will be improving the concentrate on improving the range of movements in the knee joint. So by the end of the 4 weeks, the patient on his own, he can walk, he can climb the stairs and everything, he can do all the normal activities, everything.
So, is it required to give a calcium supplement, sir, after all the surgeries?
Yeah, definitely. See, the vitamin D deficiency and the calcium deficiency is more prevalent in the Indian subgroup of population. So, generally, for all the patients who undergo knee replacements or whatever the kind of the surgeries, definitely it is advisable to take calcium and vitamin D supplementation. Nothing wrong in taking for 3 months. You no need to just go and test your calcium and vitamin D level, whether we are in the deficiency zone or we are in the suboptimal zone. So generally by taking it for 3 months, nothing harm, unless otherwise they are have some renal issues, because the only contraindications, we need to get consult with a nephrologist, those patients who suffer from renal failure or anything, for giving the calcium. And the rest of the patients can be generally can be prescribed for 3 months, they can take it.
So, when it comes to sports medicine, can you explain us about the sports medicine, doctor?
So sports medicine, it's a subspecialty in orthopedics. Those who have been more involved in the sports are prone to develop injury in and around the joint or any joints, like example hip joint, shoulder joint, knee joint, or ankle joints. So what the requirement is basically different from the general population. So sports person, they have to back to their normal function. So they have to go and play immediately after the surgery. That is their major demand. So to fulfill this demand, definitely we need a subspecialization. So we have to take care of them. No major surgeries or like open surgeries must be avoided for them. So most of the sports surgery will be performed with a keyhole surgery. It's called a arthroscopic surgery. A small nick only will be there through which a scope will be introduced, and this scope we can inspect the joint and everything. So it is a very safe procedure, and it's like a daycare procedure. So when you are inspecting itself, immediately the treatment is started. So it's like a both diagnostic as well as therapeutic. So you can diagnose the problem immediately, and the treatment can be started immediately by doing the arthroscopy.
So, when it comes to a sports injury, to whom does the patient should approach, doctor?
Yeah, definitely. The sports injury are more severe injuries. So the patient has to get a constant awareness about what is the kind of the injury, so how they have to prevent the further injuries, and immediate first aid like uh, restrict the movement, ice packs, limb elevation. Immediately you consult your sports medicine specialist, an orthopedician who subspecialize with sports medicine can handle it very well. So because awareness will be known by the doctors, so they will immediately they will take in care with prescribing some the requirement basic like x-rays and MRI. We can immediately identify the types of the injury, the severity of the injury, and what all the ligaments has been damaged, and can be appropriately treated. Either if required, no, surgery can also be performed.
So, what are the precautions they have to avoid during the sports injury, doctor?
Yeah, that is major thing. So sports injury, or as I said previously, any any patients with the general population as well as the sports person, so they have to do the regular physical activity and exercise. Those activity generally we can categorize into four types. Like first one is lubricating the joint. So anything when you wake up in the morning, you have to lubricate the joint. Then the next thing is you have to do some aerobic exercise. So these aerobics exercise like general walking, jumping, running, cycling. So this will generally activate your cardiac and improve the tone of the your back muscle as well as the gravity, anti-gravity muscles. So these are called the aerobics exercise. Then you have to go to general weight bearing exercise. So if you are belong to a sports person, means if you are concerned more as a football, or you are like a cricketer, or like basketball player, whatever might be volleyball. So those group of patients has to be taken care their shoulder joint and elbow. These group of patients like football, running, cricketers, they have to also taken care their knee and ankle and hip joints. So by proper weight bearing exercise, you are making a good tone of the muscle as well as the bone around the joint will be strengthened. Then the last one will be the proper stretching of the joints. So there will be a group of muscles will be which will be present to move the joint. So these group of muscle has to be adequately stretched and keeping in a good tone. So it should not be relaxed as well as it should not be very taut. So if it is very taut now, are prone to develop rupture in the muscle. So it is very common in when you see knee joint, means hamstrings and quadriceps are very prone to get rupture because you are not properly toned the muscle. One thing. And when it comes to shoulder joint, we call it as the rotator cuff muscles. It is prone to get damage. So proper stretching and toning of the group of the muscles has to be done.
So, is it really required for all the sports injury patients, doctor? That is the physical exercise therapy.
Yeah, definitely. See, sports injury therapy. So first we have to diagnose the impact of the injury. So how severely it has been damaged, whether the group of the muscle or any bone damage has been damaged, or which is pertain to only to the soft tissue like ligament or labrum injuries. So if it is mild and moderate kind of injuries in sports injury, definitely physiotherapy is needed. So they will be we have to give some time to recuperate our general body itself will take care, and those injury minimal injury will get healed by its time. Normally, usually 4 to 6 weeks time we go with physiotherapy, then medications, then ambulatory exercise, everything. If the patient is not improving, or if the injury is very severe, for example, in coming to the knee joint, if a sports injury person sustain a damage to important ligaments or the cruciate ligaments, then definitely these cruciate ligaments cannot be get its strength by back by doing the exercise and medication. So those group of patients immediately has to undergo the surgery. So there the keyhole surgeries plays a major benefit to them. So with a small nick, these ACL ligaments can be reconstructed and they can back to sports by 6 months of time. So if there is sports means the demand will be more. So their physical rehabilitation and it has to be in a gradual manner. So immediately after the surgery, like you can't expect you to go back to the your sports immediately. It will take some that to contact sports means you have to take a proper rehabilitation for 6 months. Otherwise, the regular patients can back to their normal work by the end of the 6 weeks.
Okay, doctor. Thank you. Can you give a take-home message to the listeners, doctor?
So the take-home message is that the arthritis can be generally prevented. So preventive, like the risk factors, as I said, joint injury, obesity, muscle weakness, adequate physical activity, then proper diet. A proper diet which includes the sufficient amount of protein intake, less carbohydrate. A protein like, for example, roughly a requirement of protein will be like 60 grams per day for a healthy adult. So this protein requirement is major necessary. So when you taken care these factors, you can avoid arthritis, and arthritis are medically manageable very well. So don't get fear to consult your doctors. It can be managed very well. You can approach us in you can approach me in Alvarpet Apollo Spectra Hospital. I'm there to treat you, guide you properly. And if required means, then only we can plan for surgery. So this is the take home message. Don't get feared by the surgery. So surgery always does not require for all the patients. Only one third group of the patients might be required, that too with severe damage only. In coming to sports injury, definitely the sports injuries has to be treated by a sports specialist. So mostly those patients of a sports injury, so don't ignore that. You can immediately consult and you can get operated by a keyhole surgery, that is called arthroscopic, and fix your ligament. Whatever might be either ligaments or meniscal or labrum, it has to be fixed immediately to retain the shape, congruity of the joint.
Thank you, doctor. Thank you so much for your valuable time. And it was very interesting to know about the joint replacement and arthritis. Thank you for the information, doctor.
Thank you all.